Huy Dũng Đoàn. I am a member of the Leigh disease disorder group. Today, my presentation is about the genetic of Leigh disease. We will discuss about three things: the location, the symptom, and the changes of Leigh disease. So let's start it. Where Leigh disease was usually located. Leigh disease, also known as Leigh syndrome, is a type of mitochondrial disease. There are 75 genes associated with the cause of Leigh syndrome. If one of these 75 genes are mutated, the disease can happen. Leigh disease can come from both the mutation of DNA or mtDNA. Most people with Leigh syndrome has mutation in nuclear DNA, and 20% had mutation from the mtDNA, also known as mitochondrial DNA. So what about the symptom? Leigh syndrome is a severe neurological disorder, which means it will affect many functions of individual body. Leigh disease symptoms are included of loss of mental, problem with movement and balance, difficult talking, weak muscle tone, and many more. So these videos will show you guys what happened with patients that have Leigh disease. Alright, this one is a child that had Leigh disease. Take a look.
We had to cancel it a day. Thomas had a surgery that wasn't planned, and she leans into me and says, gives me, we don't take this drug seriously, and she's going to kick us out of the study, and we're wasting our time pursuing other opportunities with for Leigh's, because Greg gets alerts on Google, and he's very active on trying to find support for us, support for Abby, just other families like us, and that's why we started her Facebook page, just more resources, because there isn't a lot out there. So when you have a doctor that you're
Alright. And another example of a Leigh disease patient that survived through that first 2 years and going to adulthood is this one.
Go virtual and get ready to stand out. Showcase your brand.
Alright.
My name is Chris. I'm 33 years old, and I was born with Leigh's disease. Now, Leigh's disease is a neurometabolic disorder that affects the central nervous system. And it sounds pretty bad, and really it is. Considering I'm 33 years old and I should have died when I was an infant. My twin brother and I both have this disorder. And the fact that what makes our case of this disorder more special is the fact that my brother and I are identical twins, and we're the first identical twins to be diagnosed with this disorder. We've had...
Alright. So back to the topic. So what are the changes of Leigh disease have? So, most of the changes are involved with production of chemical energy from the mitochondria. Many of the genes mutations associated with Leigh syndrome affect protein in these complexes or disrupt their assembly. These mutations reduce and eliminate the activity of one or more of these complexes, which can lead to Leigh syndrome. Disruption of complex, NADH are the most common cause of Leigh syndrome. 25 different genes are associated with this type of disruption. Next, next to it is the disruption of complex 4, COX. SIRF1 genes are one of the most frequent mutated genes that associated with this type of disruption. The mutation of NT-ATP genes, uh, mitochondrial DNA genes that provide instruction to make piece of complex B, ATP synthase protein complex, is the most common mitochondrial mutation. All the gene mutations associated with Leigh disease decrease the activity of one or more oxidative phosphorylation protein complex or effect. Additional step relate to energy production. Alright, so that's my presentation. Hope you guys enjoyed, and Merry Christmas.
Hi, I'm Rafael Vitia. Today I'm going to be talking about Leigh disease signs and symptoms. So what is Leigh disease? Leigh disease is a rare and inherited neurometabolic disorder that affects the central nervous system. It mainly affects the mitochondria. In Leigh disease, genetic mutations in mitochondrial DNA interfere with the energy sources that run cells in the area of the brain that plays a role in motor movements. Normally, the primary function of the mitochondria is to convert the energy found in glucose and fatty acids into a substance called ATP. Leigh disease causes genetic mutations in mitochondrial DNA, resulting in chronic lack of energy in brain cells and affects the central nervous system. These are some of the few medical problems that Leigh disease causes. Symptoms of Leigh disease usually progress rapidly. The earliest signs may be poor sucking ability in babies, the loss of head control, and motor skills. Some symptoms may be accompanied by loss of appetite, vomiting, irritability, continuous crying, and seizures. Symptoms may also include generalized weakness, lack of muscle tone, and episodes of lactic acidosis, which can lead to impairment of respiratory and kidney function. Respiratory problems are the most prevalent with this disease. As you can see here, there's cardiac abnormalities like hypertrophic cardiomyopathy, gastrointestinal abnormalities as well, constipation, diarrhea, vomiting, gastritis, and also, most prevalent clinical features are the neuromuscular, the central nervous system, so seizures, hypotonia, dystonia, motor weakness. It can affect the eyesight too. In early onset, Leigh disease affects 1 in 40,000 live births. Disease onset before 6 months. The result of failure to drive, brainstem lesions, and epileptic seizures associated with poor survival. If it's detected later, or if symptoms present later, it usually progresses slowly, so the symptoms go slower than kids would. Lifespan changes. Patients with Leigh disease will mostly live up to 6 to 7 years, and in rare cases may live to mid-teenage years. These are some of the features of Leigh disease, phenotypic features. Redness pigmentosa, which affects the eyes. Psychomotor regression, which affects part of the brain motor functions. Leigh-like syndrome, encephalopathy, hypotonia, spasticity, hypotonia. These are all features that affect the brain. You can notice symptoms that show in the brain. Deafness in some. Failure to thrive recurrent infection. So it's harder for them to overcome infections and certain sicknesses that normal kids usually get over. Lactic acidemia, hypoglycemia. 3. Microglutatonic aciduria. In conclusion, symptoms are caused in part by patches of damaged tissue that develops in the brain. Genetic mutations in the mitochondrial DNA affect the central nervous system. Some symptoms include severe muscular and mobility difficulties. Most patients live to 6 to 7 years old. For rare cases, they live to mid-teenage years. And here are the citations. And that is it for Leigh's disease symptoms.
There is no cure for Leigh's disease. Treatments generally involve variations of vitamin and supplement combined with therapies, and are only partially effective, although some patients may live until mid-teenage years. Leigh syndrome is a rare inherited genetic disorder that affects the central nervous system. The prognosis of Leigh disorder is very poor, and patients with it mostly live up to 6 to 7 years as a maximum. Tests that may be useful in diagnosing Leigh syndrome include measuring lactic acid concentration in body fluids such as blood or urine, brain imaging, muscle biopsy, respiratory chain enzyme studies, and genetic testing.
Today we will be discussing a case study of a female infant who was diagnosed with Leigh's disease. When the patient first came in at 8 months of age, she was referred to a pediatric consultant for having an axial hypotonia and global psychomotor development retardation, PDR for short. There were no previous family history of any related medical diseases. She had an examination done which confirmed the hypotonia, but it did not show any other irregularities. When the patient was 9 months, she began to do physiotherapy 3 times a week for 6 months. Her hypotonia did not improve much and her PDR remained the same, so her doctors decided to do a CE-MRI, which is a high-quality image of the brain and the brain stem. The day after the first CE-MRI, they had a suspicion of the patient having Leigh syndrome. They continued to do the CE-MRI on the patient for a couple months. When she was about 16 months old, the child had a hypoactivity episode during anesthesia and she was rushed to the emergency services. Neuroimaging had revealed bilateral lenticular hyperintensity, mostly in the putamen and in the left globus pallidus regions. After considering clinical laboratory and imaging data, a panel of mitochondrial genes were performed and they found a mitochondrial DNA mutation. The patient was referred for a consultation at the Reference Center for Hereditary Metabolism Diseases. For her treatment, she was given vitamin supplementation, and at 3 years of age, she was diagnosed with Leigh's disease.